Hello, and welcome to Curated Conversations, a podcast by the Grand Rapids African American Health Institute, where we talk all things health and wellness. My name is Ashley Starr, and I'll be your host for today's conversation. As you can see, our scenery has changed, and that is because we are on site at GRAAHI's annual Health Disparities Transformational Summit, an action-oriented event where leading voices in health equity tackle the vital role of policy and practice in achieving equity in Black communities. We are joined today by two esteemed guests who will help us dive into critical topics and craft a roadmap for change. Dr. Renee Canady serves as the CEO of the Michigan Public Health Institute, or MPHI, while holding a PhD in medical sociology and has an extensive history in public health sphere. Prior to joining MPHI, Dr. Canady served as health organizer and director of Ingham County Health Department in Lansing, Michigan. Her work in Lansing led to the development of the nationally recognized Ingham County Health Equity Social Justice Program. Also, Dr. Russell J. Ledet, a Louisiana native, U.S. veteran, and the co-founder of the 15 White Coats, bringing a community-focused approach to healthcare and medicine. The 15 White Coats, a world-renowned organization, has helped propel underrepresented minorities students in the next level of education by providing inspiration and economic support. With a PhD in molecular oncology and tumor immunology, Dr. Ledet's current work focuses on mental health accessibility for marginalized communities. I am super excited. We were chopping it up a little bit before the camera started rolling, and I am so excited for today's conversation. First of all, thank you both for being here. Thank you for your service. So we'll go ahead and jump right in with the first question. When you hear health equity, what comes to mind?
I think health equity for me means the people that society generally thinks of as the lowest forms of people having a loud voice. There was a short video about my life that was produced a couple years ago, and one of the quotes from that video was like, medicine and healthcare doesn't have voices from people from the Fifth Ward of New Orleans, from the Ninth Ward of New Orleans, from the Fifth Ward of Houston, South Side of Chicago, East Side of Indianapolis, Compton, Sacramento. Like, they don't have those people's voices, and so we not really achieving equity unless those voices are heard, and those voices have they have a part in the full calculation of how we dole out healthcare in our country. And the other thing I'll say too, on a more meaningful level for me, especially as a co-founder of the 15 White Coats, and as a physician, is when I look around at the people with white coats on, none of them look like me. And so what that means is that young Black boys and young Black girls come into the hospital oftentimes not being able to establish trust in a meaningful way. And when you go back to the community and have meaningful conversations about, like, what's so scary about healthcare and this and that, it's like, man, I don't think these people understand my lived experience. And so there's no point in me really doling out to them, what I got going on, because at the end of the day, they don't really understand anyway. So I think we need those voices for health equity to truly be achieved.
Yeah, no, I completely, that resonates with me, because one of the things that I'm passionate about is normalizing the conversation and just making things normal. When you walk into a courtroom and you see a white judge, nobody bats an eye, but when you walk into a doctor's office and you see a Black doctor, it's like, whoa, wait a minute. So we appreciate the work that you do.
Yeah, of course.
Dr. Canady?
Yeah, I love everything that RJ said. I'm at the stage in my career where I'm agitating. And so when I hear the words health equity, I think of well-meaning folk. Oh, yes. Isn't it so bad? Those little Black, brown people having such trouble. And the things that RJ describes with those forgotten, forsaken wards that just get overlooked, not because they're not there. Hello, open your eyes, but because we've just allowed the history of inequities to just persist, and doing nothing because we've decided it's just too hard to fix it. So I've been pushing people when they talk about social determinants of health. I'm like, we can't get to social determinants of health until we get through the social determinants of health inequities. Yeah. We can't get to health equity until we get through health inequity. And yes, that means conversations about racism, misogyny, class oppression, and all of the things that make people uncomfortable. And at one point in this nation, we were being told, well, we can't say things in a way that make people uncomfortable. No, we must. And so that's where I am now. I'm energized because I think there are enough of us sort of indignant about the things that we're seeing. There are enough of us degreed, credentialed brown and black folk in critical spaces that I do believe we're going to start seeing, and we are beginning to see action change. But I don't want us to tiptoe around a polite conversation about health equity.
Yeah, so with that, I think that in order to move the needle, you have to have the uncomfortable conversations. Would you say that you are comfortable having those uncomfortable conversations now?
For sure. And in a spirit of hope, it's a little bit like putting on some blue jeans, and you put them on in the store and they fit, and you wear them a few times, and then you wash them and you put them back on and they seem really tight. But if you wear it long enough, then all of a sudden it's comfortable again. So these uncomfortable conversations, they get easier the more we have them, and the more deep relationship we have with folk. You can say tough things when people know that you care about them and that you're not there to just shame and blame them. No, this is about authentic relationship and our working together for change.
Yeah. So how does policy and practice affect healthcare for Black patients and communities?
Yeah, I think, what I end up seeing at the end of the day is an access issue. We change, where people can live, or I think about something like redlining. Redlining significantly affected who lived where, right? And so what the trickle-down effect of that is that what communities had clinics and what communities had to drive down there halfway across the country to have access to a clinic, right? But that all that came from a policy. Like, it all came from a policy, and the trickle-down effect is that you don't have access to good food, which means your brain ain't seeing good food. You don't have access to healthcare, which means if your blood pressure high, unless it's gonna stay high, it means that you don't have access to good education. Right, so if you don't have access to good education, then it's kind of hard for you to even know what some of these things that doctors and nurses and PAs and NPs talk to you about. You don't even know what they're talking about. And the real issue, even if you go a little bit further than that, is that at the end of the day, when these families are suffering and dealing with palliative care because their families getting ready to die way too early, there's nobody that's going to come and rescue them. And families are affected. I always think about policy as, like, how is it going to affect an actual family, like the people? Because, sometimes we talk about these things in, like, flowery terms and think about it on a population level, and that all feel good. But at the end of the day, I'm worried about the people in the hood. Like, I'm going to keep it a buck with you, because, like, at the end of the day, if you ain't worried about them, everybody else going to be good. They going to be perfectly fine. And to the point that we just heard on the panel on the stage, most of the people making these decisions behind these policies, they don't even go to the hood. They don't get no food from the hood. They don't hang out in the hood. They don't go to church in the hood. They don't even pass by the hood. They don't let their kids go to the hood. But they making policies that affect the hood, right? And so, obviously, in a way, we have to be civic participants and play our role. But we also need people to come into those communities, appreciate what the people in the community are telling you, and then, and make impact based on that information, which obviously, I think it was one of the senators in there was saying that, like, she learned a lot from being in the community and understanding what was actually going on, as opposed to just saying from a distance, I think I know what's going on.
Yeah, I think a lot about policy and practice using this model that's called the FSG system of change, because the base of the pyramid is practice and policy. But what FSG did was to flip that pyramid on its head and to say the real pinnacle is mindsets and worldviews. Because, one, we do have bad policies, which then result in poor practices. But sometimes policies seem okay, but they still are contributing to these bad practices. So I'll give you an example. When I was the health officer at Ingham County Health Department, and we were also a federally qualified health center. At that time, mid-'80s, when HIV was running rampant and we were trying to figure out what to do, I was told as a senior leader that, if you have a patient that comes in for HIV care, then you can't also treat them for sexually transmitted diseases. Now, that just doesn't even make clinical sense, and I'm not a clinician. But it was a billing policy that if they came on the same day, then I could only bill for one visit, and which visit was it going to be? And my staff was, of course, saying, first of all, they had to take off they don't have leave to take off. So you're saying they're going to not get paid 2 days, even though I'm the same provider, and it's because it was Tuesday and not Thursday. So I talked to my commissioners because that was what the policy said, and their practice was following. I talked to my commissioners because it was a budgetary situation. And so I'm like, I'm not going to inconvenience your constituents anymore, because most of them were Black, brown, and battling the throes of poverty. And so I called our state and said, listen, we're going to switch our policy. You can't do that. You're not going to get paid. Yeah, okay, well, I'm not going to get paid, but I'm not going to inconvenience my patients anymore. Now, 20 years later, of course you can bill on the same day. Well, what do you mean? No, it took lots of people saying, this doesn't make sense. We should do it differently. Explain it to me again. Why are we doing it that way? But before that, people were just autopilot. Yep, okay, let's reschedule you for your Thursday STD. No, I'm in here right now with gonorrhea. Could we see about that while we're seeing about my white blood cell count? So policies, we sometimes let policies drive us and drive our mindset and our practice instead of our mindsets and our priorities and our worldviews driving policy.
And I'll add to that, to exactly what Dr. Canady just said is, oftentimes when that happens where a policy dictates someone doing something that's obviously nonsensical, especially in the clinical setting, oftentimes it's because the clinician themselves have lost their way. Like they forgot why they were doing what they were doing, and they not leading with judgment. Now they just leading with, well, this is what the policy says. And at the end of the day, you have to, policies are there to really to create guidelines, right? But it's times where you have to recognize, like, well, this policy is not appropriate. Like, it doesn't even make sense. You come in, for a chronic illness like HIV, and I see that you also got an STD. Of course, I'm gonna treat both of them, because at the end of the day, like, the reality of it is your white blood cell count is low, and I'm about to let you linger on with an infection. Your body won't be able to fight it off. So, it really takes somebody to have some internal drive and really a moral standard to do what's right by the patient more often. And I try to hold my colleagues to that standard all the time. Like, man, let's just do what makes sense for this patient. Yeah, it's going to take you an extra 15 minutes to translate, something in a Hakachin or, or Spanish or whatever. But what about the patient? Like, ain't that who we here for? Like, what you gonna do? Pander to somebody in a boardroom all day long? They don't even know what we're doing anyway. Right. So it's really about remembering that the patient is the center of what we're supposed to be doing, which is ultimately just people in the community. And we don't do that in all settings, because I tell you what, I don't care what the policy is. Go to a rich neighborhood, they gonna bend all them policies to make sure that they straight.
Yep.
So do you guys think that that's how we get policy change, like professionals and clinicians like you are making enough noise and just like, yo, this don't even make sense? Like, what is that what pushes it, and is that what drives it?
Yeah, I think absolutely. I'll give you another example. I had the privilege of serving on the governor's coronavirus task force, the racial disparity task force. And as we're looking, we're going to use really broad strokes, and we're going to try to, COVID was clearly shining the light on inequities. Well, we learned that young children or young adults that have sickle cell age out of their benefits, 18 or whatever. But if you're a young person that has cystic fibrosis, you have lifetime benefits.
Yep.
Now, I'm just saying.
Yep. And you can only imagine who got cystic fibrosis right. And who don't.
So because I appreciated being a racial disparity task force, had a lot of diverse experts on that panel. And then we said, well, why is that? And they couldn't explain to us why it was. After a while, we got data, we put it toward, and now youth with sickle cell have lifetime benefits.
Yeah. Yeah.
So it's just someone going,
something about this don't sound
make
right.
sense? I'm just feeling like, we don't have to attack people who wrote this terrible policy. No, this is not serving us well, and we need to shift it.
Yeah.
Okay, well, Dr. Canady, this one is actually directed towards you. You can chime in if you feel, but we understand the importance of the collaboration within the community. How would you mobilize community members to impact change in healthcare?
Mm-hmm. I describe myself as a relationship-driven leader. I mean, there's just nothing that we accomplish outside of relationship. And so those of us have white coats or high heels and whatever we're wearing have to figure out how to deepen relationship in community and with community. And that doesn't mean popping in for one little thing and then you're gone until you want to do, want them to participate in your research or whatnot. But it's really us as professionals seeing ourselves as part of community. Like, you don't sleep in a barn, and if you sleep in a barn, it's in somebody's community.
Right.
So somehow or another, we've dichotomized our identity that we're the professional and we're the expert, and they're the community, and there's no synergy. We are all a part of community, and so I think recognizing that the community experts are the community. I don't care if you have a degree in community engagement. You don't have a degree in relationship with this community. And so some of our easiest wins have been when we let community lead. We were doing a community health needs assessment, and our data suggested that obesity was the priority for the community. And the community said, actually, we worried about violence.
Come on.
And my kids can't walk home from school, and I'm worried about. And I mean, it was like arm wrestling with some of us in the professional realm. Well, we can't do anything about violence, and no, you can do health system. You can do something about violence because you have a master plan. You're determining where to put clinics. You have lots of influence, and so we finally did do work on violence, but it took so much work and left community feeling disrespected, unheard, and folk like me saying, no, y'all hang in there. Make me do it is what I would tell them. Y'all give me the ammunition to do the tough thing, and I'm going to go back, and I am not going to get tired of going back until we have that win for you all.
Yeah. I think there's another part to that, and some of my colleagues may get upset at me for saying this, but some of us put these white coats on and we forget where we came from. I'm going to just keep it a buck.
Let's talk about it.
Yeah, like, hey, now I could go get my nice pool and, drive my nice car. And, bruh, your barber don't care. They don't care. They need you to come in and talk about mental health. They need you to come in and talk about high blood pressure. They need you to come in, talk about diabetes, chronic heart disease, all of these things. They don't care. They do not care. They don't care, honestly, what your specialty is. They just want somebody who they could trust to have a conversation with them. And they got tons of questions. Every time I go to the church, people pull me to the side. Doc, can I talk to you about this? I'm like, yeah, for sure, it's whatever. And I'm not talking to them in some language that even I know that they don't understand, that my colleagues kind of struggling to understand. I talk to them like regular people, and I think that's extremely important because at the end of the day, bro, if you can't meaningfully connect with the community, man, like the community not going to trust you. And it doesn't matter how many, different programs you put in place, all of these different things, and the other part of it is too, is like, if you don't have a Dr. Canady who like, nah, I'm still focused on the people who don't have much, and I'm not trying to appease these people just because they didn't gave me this job or, whatever, then you don't have no advocate in that room. And the problem is that more often than not, unless you connected with the community, they don't even know you're in that room making decisions about what happened in their community. They just see it just pop up out of nowhere. A bridge just coming middle of the neighborhood, right? Just like out of the blue. Now all of a sudden we got a highway just coming through the middle of a community that's been around for 50, 60 years. And people are, kind of on both sides of that split and trying to figure out what they're going to do next. How does this affect the job market for them? How does this affect their accessibility to healthcare and things of that nature? So I think you need people in the room who could keep it real and be like, nah, bro, like, I'm here for them. Like, I'm not here to, like, make you happy. I always say, I don't need my colleagues to be proud of me. I really don't. I need the hood to be proud of me. Like, if the hood proud of me and they hold me accountable, I'm good. Everybody else, look, we all got the same degrees. We all took the same test. It ain't no point in you being proud of me. We the same, bro.
Right.
We the same.
Okay, so then we're going to direct it back to you for the final question is, we know that building inclusive care is crucial to enhancing the Black community experiences with medicine. How would you challenge physicians to impact change in healthcare, which is just a great follow-up to what you just said?
Yeah, I think, the thing that always, my presentation always challenges folks is because, like, I'm authentically me all the time. And I always ask physicians, like, bro, come on, man. Like, this is not how you was raised. Like, this is not how you was raised. Come on, I need you to remember where you came from. I need you to be authentic. I need you to listen to these folks when they come in here and tell you, like they said in the thing, like, something not right. You know, and trust, just like Dr. Canady just said, like, you don't have a degree in relationship with these people. Like, you may have a degree from wherever, but they didn't teach you about the 9th Ward. They ain't teach you about the 5th Ward. They ain't teach you about Compton. They didn't teach you about these places. So you got to go there with the mindset, I need to learn from these people. Not the mindset that I already know what the answer is. Because if you knew what the answer was and you put it in place already, then why we still got all these problems? Like, we got all these problems because ain't nobody really listening to what these communities are really worried about, right? They worried about violence. They worried about kids in incarceration. Like, we got crazy rates of kids in incarceration. We got crazy rates of black boys committing suicide. Like insane numbers since COVID, you know, and we got to really listen to what the community is saying. And part of that requires some authenticity. Oftentimes we trying to impress our colleagues, man. Like, or we trying to, impress the establishment. And the community don't benefit from that. They really don't. Like, they don't benefit at all. And of course, it's just like a big, handshake all around the table. Like, yay, look at us. And the community sitting outside like, bro, what about us? And what's crazy is y'all using their taxes in order to do all this. So, it just requires a different level of authenticity, which I will say out loud. Oftentimes people are afraid to exhibit that kind of authenticity. And they afraid because maybe it's because, they worried about what their colleagues are going to think about them, or, what the establishment is going to think about them. But my question is, what the community going to think about you? They know you a square Dito. They know you a cornball. They know you ain't really, worried about the community like you say you are. But then you come to the community, pull up to get a fade. Right. Like, it don't really line up the way it need to, and you're going to pull up to the cookout. But then you're going to go back talking crazy. So, it's really about people keeping it real. And using your intelligence too. Of course you want to be brilliant, when it comes down to diagnoses and management and all those things, for sure. But let's keep it real too. Let's do both at the same time.
I'm going to just add to that because I'm about to pass the plate on that. Dr. RJ just went in. I do also, we have to remember, as you said, y'all are the same.
Yep.
I don't care if you're of color, you're still being trained in a system that has historically not valued people that look like you.
Yep.
So we have to do some unlearning of things, some relearning, revising, editing, not only just for professionals of color, but even for white colleagues that are going to try to be a part of the solution. Because that system, I always tell I just spoke to the Student National Medical Association last week, and I'm like, okay, you're going to get on the floor, and your attendings don't have this mindset. No. Now, I don't want you to get fired. Don't call them out. But you got to figure out gentle ways to say, Dr. So-and-so, I'm concerned about X, Y, Z. Yeah. Can you clarify for me X, Y, Z? When we're doing equity work, people don't want to be a part of the dialogue because they always say, I don't know what to say. Mm-hmm. Well, you don't actually have to have the answers. You have to have the questions. Yep. Just come in there asking those leading questions like, I'm trying to grow and I'm trying to learn from you. Mm-hmm. And they will realize when they don't have an answer that they need to study and they need to rethink their lessons.
And I'm going to go ahead and put a chime in here. You need to make sure that you're reading. Legacy by Uche Blackstock, Medical Apartheid by Harriet Washington, Miseducation of the Negro by Carter G. Woodson. I could go on and on and on. The point at the end of the day is like, you need to be reading. Don't come to me saying like, oh, I don't know anything. Well, you won't know anything if you haven't read. If you ain't did your homework, don't expect to know anything.
I'm reading Frederick Douglass's biography now. Oh, man. And to think about the brilliance of a man that came through so much, and the tragedy that it is yet so applicable. And if I can be self-serving, my publishers will want me to say, and be reading Room at the Table, a leader's guide for health, equity, and advancing justice by Dr. Renee Bridge.
Yes. Well, thank you guys so much. It is really these type of conversations that bring forth awareness, and with bringing awareness, we bring forth that change. So I appreciate both of you joining me, having this conversation. Thank you so much.
Appreciate
Thanks,
you.
Ashley.
Yeah.